Okay, welcome back to part 2 of this demo for the DSD863 with fentanyl. We're showing you now the foils that come out of the box. You've got 25 of these. Also in a full carton you will get one of these, which is the full manufacturer's data sheet. If you're buying these individually or separately, you may get a skinny down quick guide to running your tests, which won't have the full data set on there in terms of cross-reactivity and interactions, selectivity, sensitivity data. But that's all available on request if you do require that. You will automatically get it in any full carton. Now the foil is individually wrapped. They've got the expiry date, batch and lot numbers on there, and again runs you through the combination and the description of what it is. And then the actual test device, this is the, we'll just show you this bit before we move on to the test device. In every foil you'll get this little bag of desiccant. We do every so often get a question, what do we do with that? Well, as it says on the packet, do not eat it and discard it once you've got your test result. Your test cassette out of the foil. It's purely there to keep it absolutely atmospherically dry and absorb any moisture to stop the test running in the pouch. So here you have a test cassette. This is a direct saliva design. You've got here a transparent cover which you remove, and there you've got the tongue, which is what you want the sample to be collected via. And then in the center flattened portion of this test, if I just bring it closer to camera, you will see the C's, which are the control lines, and then below that the drug abbreviations for each drug group. So on this one, on the left hand column you've got oxy, ket and methadone, and on the right hand column tramadol K2 and fentanyl. Now to run this test, when you're ready to do so, what you need to do is give this to the donor, or do this to the donor, is to place this tongue into the oral cavity, and you initially want to rub this in front of the teeth, top and bottom, right and left hand side, to pick up any drug residues that are on the buccal membrane in between the teeth and the side of the mouth. You would then ask them to place it within the mouth and to feed saliva with the tongue onto this test membrane, and then while it's in the mouth you should see pink dye starting to flow down towards the control lines. And the best advice is to just leave it into the mouth and wait until you've got your control lines showing with the dye having run that far. At that stage you know you're going to have adequate saliva for the test to run completely, and it can be removed from the mouth. Alternatively, once you've used these a few times and you get confident with it, you will see the test dye running along the membrane, and we'll show you that in a minute. And at that stage, if it's running well, you can usually say to the donor, yes, that's fine, it can come out now. And then basically you can resheath the collector like that, and then basically that can be laid flat. And you read this at the read time, which we will advise you on, which is between 5 and 10 minutes. So the correct set of results, the accurate set of results, are what is showing at the read time at 10 minutes. Beyond that, you would not interpret any test line development. Okay, so what we're going to do now is just add some saliva to one of these tests, show you the tests developing, and then run you through interpretation of your results.